Hello students, I am Dr. Swati and I am here to discuss with you NEET PG Recall Anesthesia question of NEET PG 2023. Now, most of the questions in anesthesia which was asked were clinical questions. So let us start with the first question. Now this is a repeat question and I will tell you the answer plus I will discuss with you all the options which can be asked in the next exam of course. So which maneuver is being performed? So this image was given and they asked which maneuver is being performed. Now this is a very expected question, right? So what is the maneuver being performed? And the option were jaw thrust, head tilt, chin lift, manual inline spine stabilization and positioning for intubation. Now this is head tilt chin lift. This is head tilt chin lift. Okay. So answer is B. This maneuver is a very common maneuver which we do to open an obstructed airway. Right? So I'll talk about this maneuver in a sequence of A, B, C, D, all the options first I will discuss. So this answer of this question is head tilt chin lift. So first option was jaw thrust. What is jaw thrust? You see this is an image of jaw thrust. In jaw thrust is also airway opening maneuver. This is also airway opening maneuver. In this maneuver also we lift the tongue from the falling on the posterior wall of the airway. Now this maneuver, what does it do? What is the benefit of this maneuver? In this maneuver, head and neck joint are in neutral position. So this is jaw thrust and this is airway opening maneuver. This maneuver maintains airway in neutral position, So this is a maneuver of choice to open an obstructed airway in trauma patient. So this is the maneuver for trauma patient with obstructed airway, So what is the expected question out of this maneuver? Similar to the question which was asked, that this maneuver would be given in the image and they ask what is this maneuver. So this is jaw thrust. How to recognize jaw thrust? Now both the hand is doing the same thing, that is stabilizing the head and neck, and with the thumb jaw is protruded forward and upward. So we stabilize the patient's face in our both hands and we protrude the mandible forward. This is jaw thrust. This is the jaw thrust maneuver. Got it? Okay. Now next maneuver which was our question, this is head tilt. The second option which was head tilt chin lift. Okay. Head tilt chin lift. This is also airway opening maneuver. Okay. In this maneuver, one hand pushes the head backward and other hand lifts the chin forward. So both the hand is doing two different things. So what does this maneuver do? Lifts tongue from posterior wall of the airway. Okay. What is the problem in this maneuver? There is a movement of head and neck joint. So movement of head and neck joint. So in trauma patient, we preferably not do this maneuver. In cervical spine stability patient, we preferably not do this maneuver. So not preferred in trauma victim. This is not preferred in trauma victim. Got my point? So this maneuver would not be preferred in trauma victim. Remember this. Okay. But compared to jaw thrust, this is a better maneuver. So in non-trauma patient, any question is asked, like a stroke patient or anything, which maneuver we have to do to open the airway? Answer has to be head tilt chin lift. So for non-trauma patient, head tilt chin lift, and for the trauma patient and cervical spine instability patient, we have to go for jaw thrust. Got my point? Okay guys. Then the third option was manual inline stabilization of cervical spine. Trauma patient until it is proven otherwise, we always consider them to have a cervical spine injury. So when we are shifting them, or when they are, let's say, taken from ground to the ambulance, we always practice manual inline stabilization. Manual inline stabilization can be done by two ways. It can be done from the head end, or it can be done from the rear end facing the face of the patient. So you can see this first one, it is done from the head end. Both the hand stabilizes the head and neck. There is support of neck also, and there is support of head also. So head and neck is stabilized, right? And other way of doing manual inline stabilization is from the rear end, right? Facing the face of the patient. Again, patient's head is stabilized with your both arm resting on both side of the neck of the patient. So both side we rest our arm on the both side of the neck of the patient, and with our palm we stabilize the head of the patient. So this hand is doing the same thing, stabilizing the head of the patient, and this hand is resting on both the sides. Okay, this is manual inline stabilization. Okay, and the fourth option was the positioning for intubation. Well, positioning for intubation, this is morning sniffing position. This is called morning sniffing position. Okay, morning sniffing position. This is a position in which what happens? The laryngeal, the pharyngeal, and the visual axis comes in one line. So chances of glottic opening visualization improves. This is manual inline stabilization, and as you can see, it is also called morning sniffing position. In this, let's say, maneuver, there is movement on two joints. Atlanto-occipital joint is extended, and there is flexion of cervical spine. Cervical spine is flexed. Got my point, everyone? So this is intubation. This is laryngoscopy position. Laryngoscopy position. Okay, this is laryngoscopy position. What are the probable question which can be asked? An image can be given, and they ask what is the position. So this would be extension of head, flexion of neck. This is laryngoscopy position. The next question which can be asked, that in what is the name of laryngoscopy position? Answer is morning sniffing position. Then a next question can be asked, that what is the movement of the joint in morning sniffing position or laryngoscopy position? Answer is extension of head and flexion of neck. Extension of head and flexion of neck. Got my point? So this is our morning sniffing position. So we have discussed the first question, the image based question. The image was given and they asked the maneuver. This maneuver is head tilt, chin lift. Okay. Okay. So coming on the next question. Next question was again an image based question. They gave the image of this device. What is this? I hope all of you must have recognized it. It is tracheostomy tube. Tracheostomy tube. Right? And they asked that what is the indication of using these devices? Well, the indication of using tracheostomy tube is same as indication of using endotracheal tube. Right? Tracheostomy tube is also used for the same purpose, more or less. Just when we have to put a patient on a prolonged mechanical ventilation, rather than keeping a patient on endotracheal tube, we do a tracheostomy, which would be beneficial for the patient in pulmonary toileting. So this is a tracheostomy tube. Now, what do we do in tracheostomy? In tracheostomy, between just above the suprasternal notch, this is the suprasternal notch, just 1 or 2 centimeter above the suprasternal notch, tracheostomy is done between second and third tracheal ring. A hole is made and this tube is inserted. It can be done by surgical method. So tracheostomy can be surgical, or tracheostomy can be percutaneous. It can be percutaneous. We do in ICU mostly percutaneous tracheostomy. Got it? So surgical tracheostomy, percutaneous tracheostomy. We can do both. What are the indication of tracheostomy? Same as indication of putting a tube. Here we are, let's say this is your airway, this is your thyroid, this is your cricoid, and here your like tracheal ring starts. So this is first tracheal ring, this is second tracheal ring. Okay. So tracheostomy, this is suprasternal notch. So tracheostomy is done in the between first and second tracheal ring or between second and third tracheal ring. We make a hole, right, either surgically or by percutaneous Seldinger technique, and we put this tube. Okay, so if there is any obstruction in the upper airway, to bypass the upper airway, we put the tracheostomy tube. If I have to put the patient on prolonged ventilation, then to give a good pulmonary toileting, endotracheal tube can also be used. But when a patient is on prolonged ventilation, tracheostomy is always better because it will provide a better, say, toileting of the pulmonary system. The risk of pneumonia, let's say, ventilator-associated pneumonia would be less, right? And weaning is also better, and patient comfort is also better with tracheostomy tube as compared to endotracheal tube. So, what are the indication of doing tracheostomy? First indication is for mechanical ventilation. Now, recently in one exam they asked which tracheostomy tube is used for mechanical ventilation. Now, tracheostomy tube can be of different types. It could be cuffed tracheostomy tube. Then we have your uncuffed tube, which is more commonly used in pediatric. But in pediatric also, if the child is on mechanical ventilation, we prefer cuffed tube in them. Then we have metal tracheostomy tube, and then we have fenestrated tracheostomy tube. Okay, fenestrated tracheostomy tube. Okay. Now, metallic tracheostomy tube, the metal tracheostomy tube or metallic tracheostomy tube has the indication when we have patient, we do the keep the tracheostomy tube just to maintain the patency of the airway, but patient can breathe on their own. Just to maintain the patency, we have to put a patient on long term on tracheostomy tube. So metallic tube is used. This can be used for a prolonged time period, and time to time it has a, let's say, obturator in it. We can clean it. It can be kept there for a longer time period. But this metallic tracheostomy tube cannot be used for mechanical ventilation. So for mechanical ventilation, the preferred tracheostomy tube is cuffed tracheostomy tube, right? So this is the tube we are using for mechanical ventilation, right? This is for mechanical ventilation. Metallic tube is mostly used for pulmonary toileting and to maintain the patency, and for maintaining patency for a longer time period. Okay, and fenestrated tracheostomy tube is used when we are, let's say, encouraging the patient to speak, right? Encouraging the patient. So this fenestrated tracheostomy tube, when we are asked, let's say, letting the patient vocalize along with the tracheostomy tube, this tube is used. So it is used when vocalization is encouraged. In patient. Okay, uncuffed tube only in pediatric, but in pediatric also not for mechanical ventilation. So what are the indication of this putting the tracheostomy tube? Mechanical ventilation, for which definitely we use cuffed tube. Okay, then second, to bypass any upper airway obstruction. If there is obstruction in the upper airway, like there is a mass or a tumor, then there is this hole made, right? Maxillofacial, let's say any trauma or let's say any issues, obstruction in the upper airway, we make a opening in the trachea for ventilation. So this is indication. The second indication is to bypass upper airway obstruction. Okay. Then the third very important use of tracheostomy tube is pulmonary toileting. Very old patient, cannot cough, right? But can breathe but cannot cough. Risk of recurrent pneumonia is very common. We intubate and later on do tracheostomy. With tracheostomy, pulmonary toileting is much better than endotracheal tube. So this is the third indication. Okay. So what were in the option? This device, first, this is a tracheostomy tube. So we have recognized the device. Is used for all the following except pulmonary toileting. Yes, it is used for pulmonary toileting. Prolonged mechanical ventilation. Yes, it is used for prolonged mechanical ventilation. Upper airway obstruction. Yes, it is used in upper airway obstruction. When we have to bypass the upper airway, we make a hole in trachea. And then assessment of upper airway. No, there is no role of tracheostomy in assessment. For assessment of airway, we don't have to put any device, right? No device is inserted for assessment of airway. What do we do in the assessment of airway? We see the mouth opening, we see the mentohyoid, mentothyroid distance, we see the joint movements. This is the assessment of airway. And for upper airway also, we don't have to use any device to assess whether the airway is patent or not. So answer is assessment of airway. So for second question, the answer is assessment of airway. Okay. Now coming on the third question, again a very expected question. This position was given and they asked, patient is kept in following position when? When patient is kept in following position? Well, you will think that this question is from which topic? Well, this is a BLS, basic life support question. I have discussed so many times with you. We discussed this flow chart in basic life support, right? How to approach a unconscious patient. Okay, how to approach an unconscious patient. I told you, whenever we have an emergency patient, whenever we come across a emergency patient, okay, whenever we come across emergency patient, the first thing which we do, we see the response, whether the patient is responsive or not. If patient is unresponsive, right? Or the patient is responsive. Now, if the patient is responsive, then we go for primary assessment. Primary assessment. What is primary assessment? Primary assessment is A, B, C, D, E assessment. Airway, breathing, circulation, disability and exposure. And after primary assessment, we do secondary assessment. Now, secondary assessment is the assessment which we do to find the cause, why patient has landed up in this position. If the patient is unresponsive, right, then we go for basic life support approach, basic life support. So what is the basic life support approach? Now, this flow chart is basic life support approach. First thing we do, if we come across such patient outside hospital, we verify the scene safety. The first step is verification of scene safety. After scene safety has been verified in unresponsive patient, we call for help. So shout for help and activate the emergency response, call the ambulance, right? After that, the third step, look for breathing and pulse. So we see the chest movement of the patient and simultaneously we feel the pulse, mostly in adult, carotid pulse. So we look for pulse and breathing within 10 seconds. Now, if normal breathing and pulse is present, both pulse is present and breathing is present, then we monitor the patient, make the patient is made in recovery position, right, recovery position, okay. What is recovery position? We make the patient lateral, extend the head of the patient, right, and prevent any secretion or vomitus of this unconscious patient to go into the airway. So that is called recovery position. This position is your recovery position. One hand supports the face, other hand is on the ground supporting the whole body, and patient is made in the lateral position and there is knee flexion, right? There is a knee flexion of the upper limb and the lower limb is kept straight. So lower limb is kept straight, flexion of the upper limb at the knee joint, right? This would prevent rolling of the patient in the prone position. This is recovery position. This is called recovery position, okay? So this is our recovery position, okay? When we do the recovery position, when patient has normal breathing and pulse, but patient is unresponsive, unconscious, Patient doesn't have any response, right? But both pulse and breathing is present, then we do this position. So in the option, patient is unconscious, no breathing, no pulse. Well, unresponsive, no breathing, no pulse, we will do CPR. We will do CPR. Patient is unconscious with pulse and breathing, we will make recovery position. So answer is B, right? For patient is unconscious, no breathing, no pulse, we do high quality chest compression. So no breathing, no pulse, right? Then we start with CPR, high quality chest compression. We perform 30 compression, 2 breath, and use automatic external defibrillator as soon as possible. So when we start with compression ventilation, high quality chest compression ventilation, and do attach automatic external defibrillator as soon as possible. When we attach AED checks the rhythm, and shockable, we give shock, resume compression ventilation. Non-shockable, we resume compression ventilation, and after 2 minutes AED again, let's say, cycles into that stop compression ventilation, let me analyze the rhythm. So once you have attached AED does its job, and we have to just follow the prompts of AED. Okay, so this is done when there is no pulse and when there is no breathing. We start CPR. Okay, and next option was patient is unconscious, not breathing, but pulse is present. Well, if patient is unconscious, that is no response, right? But breathing is not present, pulse is present, isn't it? Pulse is there, but breathing is not present. This is respiratory arrest. Respiratory arrest. Okay, respiratory arrest. In respiratory arrest, we provide rescue breath. Let's say 1 breath is given every 6 seconds, 10 breath in a minute in adult, and 20 to 30 breath in a minute in children, right? So this is respiratory arrest. In respiratory arrest, we just give rescue breath, and every 2 minutes we again check for the pulse. So this is in respiratory arrest, we will give the rescue breath. And last option was patient is unconscious, breathing, but pulse is absent. Well, this is not possible. Patient will never breathe. This is impossible situation. Patient will never breathe if there is no pulse. It is not possible. It's a hypothetical situation. So again, answer is patient is unconscious with pulse and breathing. So I will just write it here that patient unconscious, no breathing, no pulse. This is cardiac arrest. And in cardiac arrest, we start high quality chest compression. We start high quality chest compression. Okay. Second is patient is unconscious with pulse and breathing present. We just wait for the ambulance to arrive and we make the patient in recovery position, the position which has been given in the image. Third, patient is unconscious but not breathing, but pulse is there. This is respiratory arrest. Respiratory arrest, right? And in respiratory arrest, we give rescue breath. We give rescue breath. Okay. So we just give rescue breath. 1 breath per 6 seconds. So 10 breath per minute is given. And every 2 minutes, again the pulse is assessed. And the fourth, this is a hypothetical situation. That's not possible. So got it? This is the answer. Okay. So answer is B for this question. So these were the 3 questions which I got. If you can contribute in any other question, you are most welcome to write in the chat box. I will discuss those questions as well. So in the first look, these are the 3 important pure clinical questions which I got. So very quickly, I will just revise the answers for all the 3 questions. First question was, the image was given and they asked what is the name of this image. It is head tilt and chin lift. Answer is head tilt, chin lift. So the second question, they gave the image of this tube and they asked, what is this tube not used for? So this tube is not used for assessment of upper airway. First ABC, it is used for pulmonary toileting, prolonged mechanical ventilation, upper airway obstruction. In upper airway obstruction, it is used, but not for assessment of upper airway. Got it? And then they asked that when is this position made? This position is made in unconscious patient with both pulse and breathing. So patient unconscious with pulse and breathing present, we make the recovery position. So these were the 3 questions which were asked. Thank you so much. Please contribute any other question if you have. Thank you.